Hi, my name is Katie Maben. I'm going to be presenting Modern Nursing, which is a theory by Florence Nightingale. So Florence Nightingale was born May 12th, 1820 in Florence, Italy, actually. Her parents were from London, but they were on a long honeymoon or a long vacation, and she ended up being born in Italy, which is where she gets her name from. So when they went back to London, Florence received her early schooling from her father. She studied Greek, Latin, Italian, history, philosophy, and mathematics, but she did the best in mathematics and her studied languages. So after this schooling, she didn't really want to get married, never really pursued that, but she did want to become a nurse, which her parents were very against because nursing was seen as something like that a servant does or a working class woman, which she was not. She was pretty high class. But despite her parents' wishes, she received her training at the Institution of Protestant Deaconesses in Kaiserwerth, Germany. She went to nursing school because she said it was a calling from God and that she could be helping people and be doing God's work through nursing, which was really cool. After this, she did a little bit of nursing in London. She didn't really like it. She thought maybe should be where she really should be was training other nurses. But before she could do this, the Crimean War happened, so she led a group of nurses to go to the Crimean War and help them out. So this is where she really gained her fame and respect because the medical center she was working at during the Crimean War she said it was horrible, that it was disgusting, and that so many people were dying from things that they should not have been dying from. Like, it wasn't injuries from war that were killing these people, it was diseases and not getting the right medical attention that they should have. So she really whipped them into shape and adopted some standard procedures and precautions during this time with hygiene and cleanliness, making sure everybody was fed the right amount of food and took their baths and had clean clothes. So she would do her night rounds with a little lamp that she would carry around, and that's why they nicknamed her the Lady with the Lamp. So while she was here, she was writing letters to England about what was going on, and she was a really good statistician, so she used a lot of statistics to get her point across, and that gave her a lot of respect and fame back in England as well, not just among the soldiers and medical staff where she was at. So when she got back, she met with Queen Victoria and some other people, and they gave her a grant which she used to open the Nightingale School of Nursing at St. Thomas's Hospital in London. So this was the first scientifically based nursing school with actual procedures and standards involved. So on to her theory. It focuses on the role of the environment which is surrounding the patient. So are they getting enough sunlight? Is their air clean? Is their water clean? Are they getting enough food? Are they getting enough rest? Basically. Within this series, she states that nursing focuses on health as opposed to a physician, which would focus on illness, which I think that's pretty accurate. But she started standardizing observing patients and keeping accurate records. Cleanliness, she believed in protecting patients, so keeping people out that could do them harm or disturb their peace, tell them something upsetting. And I also read that she was like okay with saw the importance in like letting her patients see like small pets, which I thought was pretty interesting. That's not really in her theory, but so on the left is a picture of her, and on the right is a picture of the Florence Nightingale Hospital in Istanbul, which I thought was a good example because there's plenty of sunlight in here. It's a clean room. It looks pretty comfortable. I thought that was a good example of what she would want in a hospital room, which is standard today. Um, so the benefits of this theory is that she began standardizing hygiene in the nursing profession. And her theory benefits patients by looking at the entirety of their health, not just their illness. So seeing what else they need besides, oh, I have a cold. Well, are you comfortable? She introduced better observation and recording skills, and she really developed these during the Crimean War. But this is very important, obviously, today in nursing. I think what I learned when I was taking my CNA course, which is my certified nursing aide course, was that observation is very important, and it's very important to record what you're trying to figure out and recording it accurately, which is still practiced today, obviously, and is a standard. So the limitations of her theory is that it really doesn't take into consideration the psychosocial aspect of health. I think that in nursing today, indirect care is almost as important as direct care. Maybe not as important, but it's very important. Making sure all of the needs are met, not just the physical needs. Well, not all of them, but doing what we can to help out. Letting them see people if they need to see people. I don't think that Florence Nightingale defines the role of nurses as well as Virginia Henderson. For example, I thought that she did a really great job of really making the distinction between nurses and doctors and other healthcare professions. And she also recommends continuing care and responsibilities when you're off the clock, which I think is just not a great idea. I think that promotes burnout. Maybe back in the 1870s, that could have been a good thing, but I feel like now nurses just like when you're off the clock, you are done, you leave it behind. Focus on yourself. In the application of this today, it encourages nurses to be mindful of the environment that the patients are in, which is very important. So, are they getting enough light? Are they getting enough rest? Are they eating well? Which you can't force people to do this, obviously, but you can definitely encourage it. And I think it's important to observe and see how your patient is going to heal. And obviously, she influenced the importance of observation and record keeping, which I've already said is just beyond important. So how this goes in with my view of nursing is I've always seen nursing as a more professional or personal profession as opposed to, say, a doctor's or a surgeon or other medical professions. And that's really why I chose nursing and not some other medical profession that maybe I could make more money in, but it's not just what I want to do. I want to be personal and I want to assist these people in making them as healthy as possible and not just focus on their illness, but focus on their health. And I think that fit really well into what my view of nursing is. Giving patients an environment that improves their well-being it's the beginning of providing the best care, but it is very necessary. And I think that she was definitely on the right path. And here's my references. Thank you.